All right, everybody. Well, it looks like it's about that time. My name is Banks Peck, and I am a member of the Livingston Board of Directors, the Development Committee, and a variety of other committees. And I have been I've gratefully accepted the task of informally hosting our event this evening. So welcome to our first ever virtual donor appreciation event. While the venue may be a little bit different than what we're used to, the sentiments remain 1000% the same. We are so grateful for every single person who is in this virtual room who show up for Livingston time and time again. We are so excited to celebrate with you everything that Livingston has done over the last year with your help, how Livingston continues to be a leader in our community in terms of healthcare, grief support services, and just really helping people feel better in general. For those of you who recognize my last name, yes, it's true. I have terrific taste in men, and I did in fact marry Tom and Karen's eldest son, Ben. So he is on Kid Patrol at the moment, driving everyone to their various and sundry places. And so I'm holding it down for the Peck family over here. Obviously, we wish we could welcome you into our home for a sort of in-person donor appreciation event with all of the beautiful accoutrements that entails. In the meantime, I thought I'd just give you a quick little hello, welcome to my living room. That's the only room you get to see because I am a working mom sheltering in place with 3 teenagers, 2 dogs, a bird, a fish, and a ball python. So it's probably best that we're doing it in this format anyway. In terms of a couple of housekeeping issues or items for this meeting, we will be recording this meeting, just so you know. So feel free to participate as much or as little as you are inclined. We will make this recording available to you after the event if you have any questions that you want to revisit or information you'd like to hear again. We do ask that when we are listening, we stay on mute. That button is typically kind of at the bottom. I know for me, it's right here on my screen. So, or if you're on an iPhone or on an iPad, it's a little 3-dot button and you push that, it should say mute or unmute. And the host will be helping maintain that, and I will as well, the technical host and me. So if you are noticing that you're being muted and you're not sure why, that's why, but please feel free to unmute yourself. Actually, while the individuals are speaking, we will be muted. So given that, please feel free to use our chat feature to communicate with one another and to ask questions. That is located on my screen right there. Ask questions here. There we go. And in the chat. So if you don't see that on your screen, you just click on that. Your chat box will open and you will start to see where you can find those chat items. If you have any technical difficulty at any point, questions are about where chat is, questions about how mute works, questions about how to get your video on or off, anything like that, I am going to share my screen with you. Molly and Linda are standing by. Can everyone see that? Can I get a thumbs up if that's sharing? Perfect, thank you. If you need help, these are Linda and Molly's phone numbers. Feel free to use your camera and take a screenshot if this is helpful. And these are Linda and Molly's emails, and they are both available throughout the course of our gathering tonight for any support. And if you have any trouble throughout the way, I'm going to have my view on gallery. So just feel free to give me a wave and we'll see if we can help support you. And I think that is it for me. And that's way more than enough talking out of my mouth. So at this point, I would like to introduce our fearless champion and chair of the board, Laura McAvoy, who has some words for us all this evening.
I'm Laura McAvoy, chairman of the board of Livingston Memorial Visiting Nurse Association and Hospice, and it's my great pleasure on behalf of the board of directors, in fact on the entire management team and clinicians and staff of Livingston, to welcome you to the 2020 Donor Appreciation Event. I miss you. 2020 has had a huge impact on all of us in so many ways, and this is just one of the manifestations that we don't get to be in the same room with each other. But we did not want to have the fall go by without getting an opportunity to thank you for all of your support and to have you understand all the extraordinary responses that Livingston has made to this incredible, challenged year. We are so grateful to you because Livingston could not have made the responses that it has this year to an incredible increase in our census and our hospice department, to the challenges of additional supplies, to meeting the needs of our employees, on, without knowing that you're with us. So it is wonderful to see you, if I really could, but it is fabulous to get a chance to thank you. You're going to hear a great deal about the specifics of how Livingston has responded in 2020 from our great leader, Dr. Dial, and I'm sure that you're going to be very interested to learn how your donor support has made such a difference in our community. Volunteers are such an important part of what Livingston does, and although many of our volunteers are in trying to handle people in their home, visiting, dealing with office things, but one of the things that I'm most impressed with this year is how our volunteers and staff managed to keep the Camarillo Farmers Market open. It's a very important part of the community in Camarillo. And again, knowing that our donors were behind us was a great incentive as Livingston met all of these challenges. We have a fabulous development committee that has always been the great supporter for having this event. I need to thank each and every one of them for all that they do. And again, wishing that we were together. One of the biggest things that I miss, and I bet you do too, is we can't do hugs. I can't hug you to say hello. I can't hug you to say goodbye. But please consider yourself hugged with thanks for all that you've done, for being with us today. And please, plan to be with us in person in 2021.
Thank you so much, Laura, for your beautiful words. And now I would like to introduce our President, CEO, and Medical Director, Dr. Lanyard Dial. Take it away, Dr. Dial.
Thank you, Banks, and thank you, Laura. I too want to wish you a good evening and thank you for your support throughout the years, especially during 2020. I'm sure that each of you have stories about how this pandemic and how our social and political uproars have affected you and your families. I am so grateful that you have joined us tonight so that we can thank you for caring about Livingston. And it's my honor to share with you a short summary about how Livingston has fared during these times. I have a little over a 10-minute summary prepared for you, and I want you to feel free to use the chat feature to ask questions. You can ask questions anytime during or after my presentation, as Banks Pex has explained to you how to do the chat feature. I will take time after my words to answer all of those questions. Let me start with making sure you know how incredibly important Livingston's services and care have been during this time. The Livingston team is made up of highly trained, dedicated professionals who work diligently to deliver compassionate and high-quality care to the homebound, frail, ill, and elderly individuals of our community. Our care model, sending well-educated professional staff into the home, clearly reduces patients' needs for emergency room care and hospital care, and allows patients to be in the safest possible environment to heal. This concept has always been a central reason for care in the home. And during a pandemic, care in the home and not in an institutional setting clearly reduces the risk of infection and saves lives. Each member of the Livingston team strives to carry out our mission, a mission of service we have shepherded for over 70 years. It is certainly in the hardest of times, such as we are experiencing, that the character of our team shows through to meet the overwhelming complexities of our work. I am proud and humbled daily by our amazing staff and their tireless efforts to support and care for patients and clients. As the COVID virus began to appear in the United States in late January, Livingston began and instituted a COVID leadership team that met regularly to deal with all of our issues. During the first few months, we were meeting twice a week. Now we are gathering every other week. This COVID team developed the policies, the procedures, and the plans to ensure that Livingston's mission continued. We constructed a framework on which we focused all of our activities, centering around three major themes. First, ensuring that we continue to provide safe, high-quality care for patients and clients. Second, ensuring that we have processes in place to maximize safety of our staff. And third, ensuring that we are proactive as an employer to maintain jobs and employment for our staff. These have been the guideposts that we have used during these times, and I want to share details in each category with you. First, ensuring continued safe, high-quality care for our patients and clients. The months of March, April, and May saw a dramatic reduction in the number of patients that we were asked to care for in home health, directly related to the effects COVID was having in our community on doctor offices and hospitals. We usually run a census of around 350 patients on our care at any one time, and during these months, we fell below 200 patients on care. Subsequent to that, fortunately, we've seen a return back to our usual census during the late summer and now into the fall. Hospice census during those early months remained steady, and over the summer and fall, we've seen a tremendous growth in hospice numbers. Many doctors and many families are seeing the benefit of using hospice care to avoid unnecessary emergency room visits or hospitalizations for patients that have severe, chronic, life-threatening illnesses. Our bereavement and counseling services have also been very busy. The numbers of families using our caregiver services also initially declined, but have returned as the months have passed by. So overall, the number of people we've been able to take care of during the spring has seen a reversal and are now very busy with the volume and having patients we've cared for as we always have. During this time, many patients, families, facilities did not want our staff coming into their environment worried about us bringing COVID in. It made it difficult for us to care for people, and we made a successful shift to providing care virtually. We evaluate and treat patients over the phone and through a business version of Zoom. We migrated from live to virtual sessions on all our community educational programs and all our one-on-one and group bereavement sessions. We still continue using virtual care for many patients. Many of our social work visits in hospice and chaplain visits in hospice continue to be virtual. We were always clear from day one to our community that we were there to provide care for COVID-infected patients, either after their hospitalizations or from their doctor referrals. We've cared for 63 COVID-infected patients. 50 of these patients have been in home health and 13 in hospice. The patients cared for by our home health staff have needed specific treatments for their COVID infection, or they have been COVID-infected patients who have needed treatment for other diseases, such as a bacterial pneumonia needing IV treatment, or wound therapy, or rehabilitation therapy. Today, we have 6 patients on our home health service who have COVID infections. In 3 of these patients, that infection is still active, and our staff are using full protective equipment to perform these visits. As I mentioned, we have 13 patients on our hospice care currently with COVID infection. Not currently, throughout this time. 9 of these 13 have died, and they died because of their COVID infection. We actually cared for the first COVID death in Ventura County. They were under our care as a GIP hospice program at Pleasant Valley Hospital. We currently have 4 patients on our hospice care who are infected with COVID. All 4 of these individuals are in facilities in Ventura County, and as you're well aware, facilities are a hotbed of where this infection hits. Our patients who are there were there prior to getting infected. We were caring for them under hospice care, and they got their infection by either staff or other patients transmitting it to them. We have had no caregiver clients who've had COVID infections. So that's my brief summary of the care of patients in our community and our focus on ensuring that we still provide safe and high quality care. Our second guidepost was ensuring we have processes in place to ensure safety of our staff. Since the beginning of the pandemic, we needed to ensure that all of our staff were free of disease and we could safely perform work in our office and work in visiting patients in the community. Our COVID leadership team rapidly collected all of our available protective equipment, which I'm sure by now, throughout all the media hype, you're familiar with our language. We use personal protective equipment, or PPE. We sought resources locally and nationally to obtain more PPE, and we developed processes to distribute it to all of our staff. All of our staff were re-instructed in its use and tested for their protection while using the special N95 mask to ensure that it protected them from any entry of any types of particles. We continue to monitor and obtain PPE to maintain an adequate supply. We closed entry into all of our offices for all visitors. We mandated all staff have daily health screens. We look at their temperatures and their symptoms on a daily basis. And we required all staff who entered our buildings to wash their hands upon entry and exit to prevent COVID from accidentally coming into the building. We instituted social distancing policies within the office and with our staff in the community, and we purchased plexiglass dividers throughout the office. We instituted mask requirements for all of our staff. Masks are required to be used if you come into the office and for all staff entering all patients' homes or entering any facility. Our staff are required to use surgical masks and not cloth masks at all times that they are working for Livingston. We expanded our work at home policy and provided for office employees to have home-based offices created to continue to do their work. We ceased all staff group meetings and moved to virtual meetings. We instituted an every other week virtual town hall conference that I conducted to provide updates for all our staff on COVID-related details so that all our office and field staff were kept in communication with what our plans were. We have not and are not currently performing any routine COVID testing on our staff. We have had 64 staff members tested during this pandemic, the majority because they've had their own symptoms and have sought their own medical care and their own testing, or they have had exposure out in the community and wanted to be tested. We know we have had 4 positive employees. All 4 were in quarantine. 3 of the 4 are currently off quarantine and have returned to work. None of these staff had serious infections. None were ever hospitalized. None of these staff were seeing patients during the times that they were contagious. We continue all of these above processes to this day. And I want you to understand that despite everyone in our country feeling exhausted, burdened by the issues of masking or social distancing or hand washing, these remain essential focus for us. You must continue to be diligent about what you do to protect yourselves and others. So at this point, I also want to put in about flu shots. It is flu season coming up. Flu shots are available. If you haven't had your flu shot, Livingston has flu shots. Please contact us, but you should have a flu shot, even more this year than in any year in the past. My last piece is our third guidepost. We wanted to ensure that we were proactive as an employer so that we could maintain jobs and maintain our staff. We made it clear to all of our office and clinical staff that they were essential. Essential for us now and essential for us in the future to accomplish our mission of care in this community. We are essential workers in the healthcare system. We wanted them all to know that we would do everything possible to assist them in maintaining their employment and in balancing their lives with their work. As I mentioned above, creating opportunities for work at home, for our office staff, and virtual visits for our clinical staff was a fundamental to this commitment to maintain their jobs. How have we done financially during these times to support that? Well, first let me talk about fundraised dollars. You all support us and we are so appreciative of that. Your financial support has been critical during this time. We have certainly seen a decline in the overall fundraised dollars for Livingston. Most of that has been attributed to our inability to conduct our usual fundraising events, but also general donations to us and to many nonprofits have been down during the time of this pandemic. Grant support has been below our budgeted plans. As Laura mentioned, we have been blessed with a dedicated group of volunteers and additional volunteers who have successfully continued the Camarillo Farmers Market efforts. And those funds have been essential to support our counseling and bereavement services. Our year-end fundraising efforts have always centered around our light up events, honoring loved ones who have died. We usually do 3 live celebrations, but this year we're putting our final details on an interactive virtual event. We hope that this will be a memorable way to honor your loved ones and provide funds to support our care. Our second issue in terms of finances are obviously our operational finances. And they were negatively impacted by the decline in volume during the initial months of COVID. Also by the increase in expenses for PPE and for the supplies to make our staff and patients safe, and by our commitment to continue to provide income for our staff despite not having patient volume. Fortunately, we worked rapidly to be at the front line for the federal dollars that were available to support employment. and we were successful in obtaining a small business loan related to the Payroll Protection Program. This was crucial for us during those initial months of the pandemic and allowed us to have the financial resources to pay our staff's wages despite the significant decline in our business and our increased expenses. We continue to support our staff even as our volumes have come up. Our challenges now include staff who need to attend to their older parents or their children. They're struggling to balance work and life with this pandemic continuing and their need to provide caregiving and virtual education. We're being creative with work at home options, work hours, reassignment of work tasks to accommodate their needs. As of today, we have had a successful 9 months in maintaining our employees and in having the finances to continue to provide care for all who need us in the community. Let me end my summary and give you some advice that I gave our staff during one of our town hall sessions. The last many months have changed our lives and have presented us with unprecedented challenges. It has been very stressful, and unfortunately, at times it seems to not have an end. I have said in my previous leadership meetings over the years, an old adage that helped me and I hope helps others to pace themselves in the midst of ongoing stressful situations. Think of these times as a marathon, not as a sprint. In a marathon, you pace yourself. You can't run without taking breaks to hydrate, to eat, to use the bathroom. You cannot sprint through a marathon. You won't make it. So in these complex times, find and cherish your breaks. Take time to hydrate, to eat, to rest, to exercise, to be with your family. Pace yourself. Unfortunately, this pandemic continues, and your ability to make it through depends upon you making it as a marathon, and that will bring you successfully to the end. We have offered to our staff, and I want to offer to you our services in this regard. We have a very talented group of professional counselors who have made themselves available for anyone who wants to turn to them for help. These are difficult and stressful times, and there's clear power in personal counseling support. If you would like our help, please reach out to us. Our resources are available to help everyone in our community. Thank you again for your support. Let me now turn and answer any of your questions.
Dr. Dial, we did have a question about the flu shot. The question says, I have a question. It relates to COVID-19, sort of. Since I wear a mask and practice social distancing, do I really need to get a flu shot? You spoke to that a little bit earlier. I'm curious if there's anything you'd like to add. Are there additional risk factors for any of us during this time of COVID? Any additional color you'd like to add to that question?
Well, despite wearing masks, despite social distancing, people are still capable of capturing an infection from either COVID or influenza. And the last thing you want to do is be dually infected. Individuals who get either one are at risk, and if you happen to be the unlucky one who gets both, I think it would be a terrific problem, and so I would encourage everyone to get a flu shot. There is no risk to getting a flu shot, and despite the fact that you're going to try your best to avoid it, I think a flu shot is another way in the armamentarium. And of course, as soon as we are able to get a safe and effective COVID vaccine, we're all going to take COVID vaccines and influenza vaccine.
And we have another question that just came in. Thank you so much for that, Dr. Dial. The next question is, actually speaks to that last piece you just touched on. Do you think a vaccine soon is realistic, and what does that look like?
Well, soon is the key part. I do think we will have a COVID vaccine. I think there's a lot of politics behind the soon word. I suspect that the COVID vaccine won't be available till 2021. And I do think, though, that we will have one. I think it will be deemed and found to be safe, and it will be hopefully as effective as flu vaccine, if not better than flu vaccine.
Okay, and I'm going to jump in because I actually have a question for you, if I may.
Okay.
I miss hugs. Is there a way to hug safely during the pandemic?
So I don't know that anyone has absolutely done the study to prove anything, but let's think through the logic. If you're touching another person or touching an item that has COVID on it, your skin of your hands, unless you have a cut on them, or on your arms as you do the hug, should protect you from that COVID getting into you. The next key is where that skin of your hands touch second after you've hugged. If those hands come to your face and you bring whatever you've touched into your mouth, nose, or eyes, that's where transmission happens. So certainly touching another person, as long as after you do that touch, you wash your hands effectively or use alcohol-based solutions, that would protect you from the physical part of the hug. Now you have entered into the bubble of the other person. Surrounding that other person's bubble is their aerosolized secretions. So the most effective way to try to prevent that is for both of you to have a mask when you do the hug. If you both have a mask, you're not breathing into each other's faces. You wash your hands afterwards. That's the best you can do. So if you feel like you have to hug somebody, that's the steps to take to protect yourself. Can I tell you that that protection is adequate? There's been no studies for me to tell you that.
And we won't hold you to that. I was just curious if there's a way to hug my family. I love them.
Well, again, I think what we do for people who are already in our bubble, I think hugging, kissing, and your bubble is your bubble. It's for people outside of your bubble.
Thank you. Let's see, Dr. Dial, do you think the numbers will continue to go down in Ventura County? This one came to me privately through the chat.
Yeah, well, I am hoping so. I think we're in a little bit of a problem right now in many areas in the country. We're seeing a rise again of in COVID infections. No one can tell you right now whether this is the second wave, whether this is increasing after the first wave, whether our relaxed public policies have led to more infections. But certainly there is still virus out there, and there's still virus being perpetuated between people. So what will happen specifically in Ventura County, I think we're continuing to see less and less, but I think we're at risk for increasing infections. Be safe.
Thank you.
Use your mask.
Yes, and
continue to social distance. That's the problem, is I think we're getting tired of doing this. And by letting down our guards, we're going to get infected.
Okay. Gosh, questions are coming hot and fast. You said, let's see, Dr. Dial, you said your staff uses surgical masks. Are cloth masks or bandanas okay?
Well, so I specifically put in there that our staff use surgical masks, hoping someone would pick up on that and ask the question. There is absolutely no question, if you want to prevent transmission of a viral particle, that you should be using what's called the N95 mask. That's fit tested for you so that no particles can get in. Anything short of that increases your risk. The next best that has been studied is a surgical mask. Properly worn over the mouth, over the nose, that has been tested over and over again. The problem in the cloth mask world is that everybody and their brother has an idea of what a different kind of cloth mask is. Some will pull their t-shirts up, some will use a bandana, some have purchased special kinds of cloth masks. And so because I felt strongly, and our clinical leadership team looking at COVID felt strongly, that for us at Livingston, all of our staff would wear surgical masks for work. We wouldn't then get into that cloth mask is no good, that cloth mask is putting other people at risk. We wanted to level the playing field, so we required surgical masks for work habits for Livingston employees. I did encourage employees through this kind of conversation that where they were on non-Livingston time, that they could choose to do what they wanted, but that the best protection for them and their loved ones was still a surgical mask.
Okay, and it looks like there's a follow-up. Tom's asking, what about the KN95 mask?
Yeah, so the KN95 mask is not as effective as an N95. It looks to be as good as a surgical mask. So a KN95, we do not use in our COVID-related cases. We consider it as good as a surgical mask, and so it can be used, and it certainly would be better than a cloth mask.
Okay. Any other questions for Dr. Dial about COVID, about Livingston's response? Anything else? The value of your support? Okay, well, it looks like that covers all of the questions. Laura and Dr. Dial, thank you. Thank you for everything that you do to lead this incredible organization. I know I speak for myself, and I hope I speak for everyone in the room when I say thank you for the Herculean efforts and incredibly creative problem solving that you have undertaken over the last 7 months, if not more, since we first started hearing about this.
As I mentioned, we have an incredible leadership team and an incredible staff, and I really, I'm honored to be a part of this organization.
Well, we appreciate you, and I am too. You know, I'm really, I always feel so grateful to be able to be a part of Livingston, and whenever I come to these events, I feel so humbled and so proud to be a part of an organization that is at the forefront and is a first responder and a leader in caring for our entire community in so many ways. And thank you to all of you on the call for continuing to show up for Livingston year after year with really, really important and significant support. As you know, and as you've heard from Dr. Dial and from Laura, we could not pursue our mission without every single person on this phone call, this Zoom call. You are important, you matter to us, and we love you so very, very much. And with that said, I miss you all. I wish I could hug you. I can't wait until we have an opportunity to do this again in person. Hopefully someday when it's tidier, I can invite you all into my actual home and not my virtual home. But for now, this will have to do. And thank you so, so very much for all that you do for Livingston. Happy Donor Appreciation Event, COVID version, circa 2020. Big love and hugs to everyone. Take care.
Thank you, Team Livingston.